Hello, my beautiful people. You're welcome back to today's edition of Health Education. I'm still your girl, Nurse Juliet, and today we'll be discussing the predisposing factors to cardiovascular disorders. If you don't know what cardiovascular disorders are all about, kindly go check my previous video so that you can get a glimpse of what it's all about, okay? So, let's begin. There are so many predisposing factors to development of a full-blown cardiovascular disease. For reference purpose, predisposing factors are also known as risk factors. So don't get confused if I use the two interchangeably, alright? So the first risk factor that we'll be discussing today is alcohol. Excessive intake of alcohol can actually cause a full-blown cardiovascular disease. How does this happen? Alcohol stimulates the adrenal gland, which is one of the glands in the human system, to secrete a hormone known as cortisol. Cortisol is a stress hormone. What does cortisol do? Cortisol helps to manage stress. It also reduces inflammation and also regulates our blood sugar level and our blood pressure. So excessive intake of alcohol can actually lead to the hyperstimulation of the adrenal gland to secrete excessive cortisol. So when this cortisol is in excess in the system, the person's blood sugar level will definitely be high, and if not treated, the person might end up with diabetes mellitus. The person's blood pressure will be high, the heart rate will be high, and the person might end up with a full-blown cardiovascular disorder such as hypertension, cerebrovascular accident, which you also know as stroke, heart attack, and arrhythmias, amongst others. So you've seen how excessive alcohol intake can actually cause a cardiovascular disorder. Another predisposing factor in my list is smoking. Some of you are already excited that they don't smoke. But let me tell you, you don't have to be an active smoker to be at risk of these problems. There is what we call secondhand smoke. This is when you are constantly exposed to burning tobacco. That means you're always in the environment where the smoke are being released in heavy quantity. So as you're inhaling, you're taking in those substances into your system. And just like active smokers, you are also at risk of developing cardiovascular disorders. Smoke actually damages the heart and the blood vessels. When the blood vessels are damaged, they become more prone for fatty deposits to build up along the lumen of the blood vessels. This also makes it more prone for blood clot formation, and this tends to impair blood flow through the blood vessel. Secondly, smoke contains a substance known as nicotine. Nicotine stimulates the sympathetic nervous system to cause the release of a hormone known as noradrenaline. This noradrenaline has been linked to increase the blood pressure and heart rate. Research has also shown that smoking can actually cause an increase in the viscosity of blood. What do I mean by this? This simply means that your blood becomes thicker than it should. And when this happens, the blood flow becomes sluggish, giving room for blood clot formation. And this will definitely impair blood flow to vital organs. Overall, people that actively smoke or are constantly exposed to smoke are at risk of developing cardiovascular disorders such as hypertension, arrhythmias, myocardial infarction, which is also known as heart attack, cerebrovascular accident, that is stroke, among other heart problems, including heart failure. Actually don't intend to bombard you with so much information. So because of this, I'll be calling it a day. In my next video, we are going to discuss in details other predisposing factors to developing these cardiac and vascular issues. I remain your girl, Nurse Juliet. See you in my next video. Bye.